I'm Vinod Thourani. I'm one of the cardiothoracic surgeons at Emory University in Atlanta, Georgia. And at the ACC 2013, I have the privilege of presenting the data for the Partner 1A trial with the 3-year follow-up data. I follow the great presentations by Dr. Craig Smith and also Sushil Kadali, who have presented the 1-year and 2-year data for Partner 1A. And so the 3-year data is different in the sense that this now allows us some mid-term analysis of the partner patients. This is a study that looked at 244 transfemoral patients and 104 transapical patients, which were then randomized to surgical valve patients, 248 in the arms against the transfemoral patients and 103 in the arms for the transapical patients. What we found was that all-cause mortality in the ITT analysis was a 44% mortality in the transcatheter valve group and a 45% mortality in the surgical valve group. And this basically has shown us that there is an equivalent in high-risk patients undergoing transcatheter valve therapy or surgical valve therapy. There's an equal mortality at 3 years. We also were able to find in the Partner 1A study for the 3-year analysis that symptom improvement was great in both arms. Both the transcatheter and surgical valve replacement had the majority of the patients were in greater than 80% of class 1 or 2 NYHA classifications. So we really benefited symptom improvement in both arms equivalently. Stroke was higher in transcatheter valve patients in 30-day, which was presented by Dr. Craig Smith. However, we have now shown that at 3 years, there is no late increased stroke hazard in the transcatheter valve group. And that really allows us to look at a longer-term outlook, which shows that there is no difference between surgical or transcatheter valve in strokes at 3 years. What we were also able to look at in the 3-year analysis was structural valve deterioration. And that has been a question that many of us have had, is how long will the transcatheter valve implants do on at least at 3 years follow-up. When looking at the echocardiographic data, we found that both the surgical and the transcatheter valve therapies have allowed amelioration of the aortic stenosis. We have maintained the aortic valve area in these valves. We've also had the initial decrease in the mean and peak gradients has sustained up to the 3-year mark. And so we're able to say reliably that there's been no structural valve deterioration in either group. Again, that is something that we as a community have been asking ourselves for the transcatheter valve therapies. The paravalvular leak rate, as we have seen as first presented by Dr. Kadali at the ACC 2012, this year there's an expanded look at the 3-year data for the paravalvular leak in those patients undergoing transcatheter valve therapy. What we were able to find is that in surgical valve replacements, none or trace paravalvular leak was in 90% of the patients versus 60% in the transcatheter valve group at 3 years. And so we also have found that in total aortic regurgitation that there is still an increased mortality in those patients that have a mild aortic regurgitation after the procedure, in addition to those that have moderate or severe aortic regurgitation after transcatheter valve therapies. So in summary, for the Partner 1A 3-year data, what we're finding is that surgical valve therapy and transcatheter valve therapy in those patients with high-risk category with severe aortic stenosis, there is equivalent all-cause mortality, symptom improvement, structural valve deterioration. However, what we have found is that those patients who originally had a higher stroke rate in transcatheter valve therapy, that difference has now at 3 years no statistical difference in the stroke rate between the two groups. We're also finding that the paravalvular leak rate does have increased mortality in those patients who have a mild, moderate, or severe leak in those patients with transcatheter valve therapies. Thank you.